I am Dr. Praveen, Consultant Cardiac Anesthetist and Intensivist, practicing here in Frontier Lifeline Cardiac Anesthesia. Anesthesia in cardiac surgeries is slightly a little bit different when compared to other surgeries, because in other surgeries only that particular system is going to get involved, but anesthesia in cardiac surgery almost all the organ systems are going to get involved, and hence it is much more different and partly difficult also in a way when compared to other surgeries. The hemodynamic disturbances and the way the cardiac surgery per se affects the entire course of the surgery and the patient's physiology is going to be totally different. So definitely anesthesia as far as cardiac surgery is more challenging and more different. Cardiac surgical patients have to be evaluated first from a cardiac point of view, like the overall functioning of the heart, completely evaluate. And another important part of the evaluation is head to toe evaluation, because we'll have to evaluate how good the other organs and other parts of the body are functioning. We need to know those baseline characteristics and we need to evaluate them completely before we put them under anesthesia. During cardiac surgery, there is a lot of hemodynamic disturbances. Like for example, in general surgery, there will be hemodynamic disturbances in general surgery as well. But the overall hemodynamic disturbances are not going to be the same when compared to cardiac surgery. There will be extremes of pressure as far as highs and lows are concerned. There will be high pressures as well as low pressures happening during the course of the surgery. And when we say cardiac surgery, it actually doesn't just limit to the operation theatre alone. It also continues to the ICU as well. So this basically it is a minute-to-minute monitoring, or to be even more precise, it is a second-to-second monitoring. So every beat is being monitored, and for that every beat, what is the corresponding pressure is being monitored, and for every minute we need to know the exact oxygen saturation. So a lot of factors have to be, or a lot of vitals have to be monitored as far as cardiac surgery is concerned. It's not like a 2020 game, it's like more of a test match where you have to monitor them for a period of 2 or maybe even 3 days. So that is as a whole, you need to monitor them more precisely and continuously. Since the advent of cardiac surgery in India, the monitoring systems have evolved over a period of time. The routine things which are monitored are the heart rate, blood pressure, and the oxygen saturation, and as well as the central venous pressure. There are also a number of other things which are also being monitored. For example, the temperature of the patient will be monitored continuously. The hourly urine output will be monitored continuously. And not for all subsets of patients, but for certain populations, we also do the neuro monitoring, where we monitor the saturation as well as the blood flow to the parts of the brain. So that is also being monitored for certain populations. And sometimes we also monitor the cardiac output, the overall blood flow to the different parts of the body. So that is also being monitored. And for these, we need to use more invasive devices. So basically, in other words, the role of a cardiac anesthetist is from the time preoperative preparation till the time of shifting from the ICU to the room or wards, the entire vitals have to be monitored. So it is like a constant monitoring. Yes, there are clinical ways of assessing a patient, whether the patient is stable or not, but these devices which have been placed at the time of induction of anesthesia help us in monitoring all these vitals continuously during the intraoperative period as well as in the postoperative period in the ICU.